Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. And today's topic is a breast lift. And I'm not a plastic surgeon. I do not perform breast lifts. But in my years of experience, I've seen many women who've been interested in them, who've undergone the breast lifts, some who've been very pleased and happy with their outcome, and some less so. And so I thought I would explain and discuss what are some of the distinguishing characteristics between the women who are happy and satisfied, how it was worked out for them, and those who were less than satisfied. So some women with larger breasts complain of significant problems with discomfort. They have divots in their shoulder from the bra straps, they get backaches, they get headaches, they have significant discomfort and impedes their ability to do athletics. And those patients often do well with the surgery. If they meet that criteria on evaluation by their plastic surgeon, getting that surgery can reduce many of those symptoms, and I've seen many satisfied patients. They do get a scar, and that scar looks like an anchor, so it's around the nipple, it's down and to the sides. So expecting a perfect cosmetic outcome is one of the potential downsides. So I encourage you to look with your plastic surgeon at before or after photos, recognizing that the photos you're going to see are their best outcomes. And not all the outcomes come perfect. There is a little bit of distortion sometimes. The shape of the breast can change from perfectly round to having little slight corners, almost like a beanbag chair, or some asymmetry. And sometimes the scars can spread out, especially if you're somebody who fluctuates with your weight. Also, if you're a smoker, more chance of infection or problems. There are risks. See the link that I provided. Talk to your surgeon about all the risks. That's not what I'm here to discuss, and the details of the surgery. I'm again just trying to point out the women I've seen who've been satisfied and the women who've been a little less than satisfied. So those who've been a little less than satisfied are the women who didn't have very large breasts with the divots or the backaches, but more the cosmetic effect because they were unhappy with the drooping, or it's called, the medical term is ptosis, falling of the breasts after kids or breastfeeding or just with aging and time. And those patients, if they have realistic expectations, can end up happier, but some of them have expectations of basically bringing their bodies back to the way they looked when they're 18, and for them there is the risk of disappointment. If you look at the before and after photos, you'll see that there are some scars, and they don't always turn out, as I said, as clean and pretty as you might expect. There is some distortion. And so some of my patients have been disappointed that they changed one complaint about the shape of the breast with a new complaint about their shape of the breast. So I will try to provide some photos at the end that I've seen to give you some of the experience. You can look yourself. If you're doing the surgery primarily because of discomfort, you're more likely to be happier. If you have realistic expectations and don't expect perfection in the results, you're also more likely to be happy. And I encourage you to discuss this further with your surgeon before entertaining the thought of such a surgery. I hope you found these useful, and please look at the end. I will try to provide some photos to point out some of these differences. Thank you.